Hello and welcome to today's webinar on supporting early development and learning, made possible by the Robert Wood Johnson Foundation. Before we get started, I'd like to quickly go over a few logistics. To eliminate background noise, phone lines are being muted during today's event. There will be a moderated question and answer session following today's presentations. You may submit a question online anytime by clicking the Q&A icon located at the bottom of your screen. Instructions are shown on the screen at this time. Today's event will be recorded and shared publicly on chcs.org. At the end of the webinar, we ask that you please complete a brief online evaluation that will pop up on your screen. Your feedback is very important to us, and we hope that you'll take a moment to do this. I will now turn the webinar over to Armel Cazo, Senior Program Officer at the Center for Healthcare Strategies.
Thank you so much, Travis, for starting us off and for assisting with the webinar today. This webinar is third in the series on early childhood and Medicaid innovations amid COVID-19. We are so grateful to the Robert Wood Johnson Foundation for their support for the Aligning Early Childhood and Medicaid initiative, which is focused on aligning state programs and investments between Medicaid and early childhood systems to drive more strategic, evidence-based investments for infants and toddlers in low-income families. This initiative is also focused on demonstrating the value of early childhood cross-sector alignment for improving near and long-term health and social outcomes. Our partners on this initiative are 0 to 3, the National Association of Medicaid Directors, Social Determinants of Health Consulting, and the Public Leadership Group. And I'll now turn it over to our moderator, Gretchen Hammer, founder at Public Leadership Group. Thank you, Gretchen.
Thank you so much. It is wonderful to be with you all today. My name is Gretchen Hammer, and I am the founder of the Public Leadership Group, and I'm really pleased to be the moderator for our webinar today. Today, we have pulled together 3 experts in the field and to talk about their efforts to ensure that early childhood development and learning has continued during this unprecedented disruption in the lives of young children. Between the pandemic, the economic recession, the racial justice movement that we're experiencing in the United States, there's been a real disruption in some of the structures and systems that support young children. But we'll hear today from Ohio, from North Carolina, and nationally from the National Head Start program about the things that they have done to continue to support child development and learning during these unprecedented times. After we hear from each of these experts in the field, we will have a panel discussion that I will moderate, picking up on a couple of things that they have shared, as well as beginning to turn toward the future and looking at resiliency and recovery for our young children and their families. We also will have, hopefully, the opportunity to take a few of your questions. So as Travis mentioned, please use the Q&A function to submit your questions. If we don't get to them live, we will have them as part of the record of this webinar, and we'll try and respond to them potentially later. So with that, that's our agenda for the time today. And we are going to jump right in because I know that you all are well aware that the earliest years of a child's life are all about relationships and experiences. And if there's anything that's been disrupted during these times, it has been our relationships and our experiences. Childcare and early learning settings closed, at least temporarily. Many have remained open, especially for essential workers. Some are back online now. There's been missed and skipped well child visits or other critical therapies that young children with delays need to make sure that they catch up and are on the trajectory for their development. And we also know that there's been an increase in family stress, in particular among families of color and families who make lower incomes. And so this is why I'm so excited about the 3 panelists we have here today. Each of them have taken a piece of that puzzle and have responded to it remarkably. And so we're going to start first with the state of Ohio and Dr. Wendy Grove, who's the director of the Office of Early Learning and School Readiness at the Ohio Department of Education. And what Dr. Grove is really going to share with us is the focus that they have had on supporting the social and emotional health of students and staff, importantly, and staff during this pandemic. So with that, I'm going to turn it over to Dr. Grove to further introduce herself and to have her share with us her work from Ohio.
Thank you, Gretchen. Hi, everyone. It's Wendy Grove. And like Gretchen said, I am at Ohio's Department of Education. And in the office that I oversee, we really take a birth through grade 3 approach. And so everything that we do is aimed at supporting families and educators in order to support the children who are in their care and education during the day. Next slide, please. I wanted to do a few slides for you that have the linked resources. So we spent time, like everyone else, and made sure that we could get out guidance quickly, but guidance that was well resourced and using what we knew about early childhood, how children learn, how parents learn and spend time with their children as they play. And so we did a few things here. I won't read through all of these, but you'll see we have an early learning guide for Restart. So we wanted to make sure that we were giving developmentally appropriate guidance for our earliest learners. We also thought it was very important to not gloss over the fact that not only was this a disruption for our children and families, but it was so for the staff, everyone from cafeteria, bus drivers, and teachers in our schools and early care and education settings. We also knew that there was no way around it, that even our youngest learners were going to be engaging in instruction through remote learning. And so we wanted to make sure that we had guidance for schools and families as well on this, in how to do that. And then finally, health and well-being. We wanted to make sure that we were telling parents about the whole child supports and balancing the stressors of the pandemic, including how do you model resiliency and have adult conversations among adults. Next slide, please. And while I pulled out these 4 particular guidance documents, I did want to make sure that you had the link to our whole set of resources that have been created just during the time we have been in the pandemic. And as you can see from the list there, we do focus on particular populations as well as topics. And so you can go to this link and look at any one of those. Next slide, please. And then just to round out my introduction and the work that we are doing, I wanted to make sure that you had a sense of my and our agency's orientation to this, which is how do we support young learners during a pandemic and outside of a pandemic. And so we wanted to make sure that we are always talking about meeting our basic needs, right? Our children in safe places. Are they getting the nutrition and food that they need? Are we talking about their health and well-being as well as their educational access? And talking about software and hardware, broadband, all of those things that allow instruction to take place during the time which schools had to be closed. In addition to this, these last 2 bullets, connection, that social and emotional connection as for both the children and the adults in their lives. And then finally, normalcy. So young children play and they learn through play. And so we wanted to make sure that our guidance really had this perspective at the forefront so that we could help everyone in a very unique, first in a lifetime experience of a global pandemic understand that very young children still want to play and they will do their learning through play. And with that, I will turn it over to our next presenter, or Gretchen. Thank you.
Sure. Yes. Thank you so much, Dr. Grove. I really appreciate it. And I so appreciate the care with which you thought about our young learners and their families and this sort of comprehensive look at their lives. I'm sure that the children in the state of Ohio were well served by this approach. I did want to turn now to the Medicaid lens or the health lens, right? So we started with the education lens and we'll turn to the health lens. And we know that Medicaid plays a key role in supporting all young children to have the access to healthcare, to have their immunizations, to have the appropriate vision, hearing, developmental screenings. but that also Medicaid plays a key role in early intervention services for children who may have a delay, either a physical delay or a developmental delay. And so one of the challenges that we encountered as Medicaid programs across the pandemic was how to continue to make those critically important and developmentally timed therapies and supports available to young children, given the disruptions that Dr. Grove talked about. So here we'll hear from Dr. Emma Sando at the North Carolina Medicaid program. And Dr. Sando, if I could turn it over to you and have you share about how you all adjusted your services so that young children and their families could still get the services they need during the pandemic.
Sure, and thank you so much. Next slide. So when the pandemic started, North Carolina unfortunately has quite a history with instituting policy changes as a result of an emergency due to our beautiful coastline and all of the hurricanes that our state sees. So we were able to very quickly respond to the pandemic through a variety of different activities. And this is just a snapshot of all the things that we implemented almost overnight here in our state. A new eligibility program, and a lot of payments to various providers. But the one I want to draw your attention to is on telehealth. We instituted hundreds of different changes to our policies in our Medicaid program, but specifically over 135 new telehealth policies were implemented almost overnight. Next slide. So North Carolina had virtually very little telehealth in our state prior to the pandemic starting. We allowed for some facility to facility based telehealth services, but for the most part, it was not beneficiary focused. And we overhauled our program in March of 2020 to allow for improvements to our telehealth services and have work to maintain a lot of those services. Here you can see that when the pandemic hit, we saw a relatively large spike in comparison to where it was before in our telehealth services, and those have relatively maintained after the stay-at-home order ended, and as more and more people are returning to doctor's offices and whatnot, we continue to see these telehealth claims for a lot of our services. We have made it permanent for speech therapy, which is crucial for families because it allows them, if they have issues with transportation or childcare in a lot of our rural parts of our state, to be able to access some of those speech and therapy, and local education agencies are allowed to have a psychological services and counseling treatment through telehealth, so that that people can continue to receive those services even if they live far away from where the nearest a psychologist or counselor may be. We also noticed that there weren't a lot of materials available to beneficiaries about how to use telehealth, since it was very new in our state. So we created English and Spanish flyers and beneficiary-focused materials, videos with pediatricians explaining how to use telehealth services. It varies based on the practice, but we had a how-to guide specifically targeted at beneficiaries, which I think was a very novel approach, because most of the education materials have primarily not been targeted at children or families and children. So the next slide, we also, when looking at child visits and immunization rates, noticed that these children just weren't getting the care that they previously had been while we were in the pandemic. So we worked together with a variety of different partners, including Reach Out and Read, which is a program that helps children with their social and emotional development with reading, also with pharmaceutical companies and groups across the state, in order to implement the Keeping Kids Well initiative, which did a variety of different things, really trying to educate both providers and beneficiaries about the services that they can receive. And we've done a lot of work to make sure that children are having access to the healthcare that they previously had access to when they were in the school settings, and were more connected to the Medicaid program. So this is a really wonderful partnership that we hope to learn from and continue as we're transitioning into the next phase of the post-pandemic life. I'll turn it back over to you.
Great. Thank you so much, Emma. I really appreciate it. Dr. Sando, I really appreciate that concept of helping people learn how to use telehealth, right? It's not intuitive. And if you've not done it before because it wasn't the way most services were delivered, it makes a lot of sense that that kind of support would be necessary. So I know I have some additional questions for both Dr. Grove and Dr. Sando, and we will catch up those after we hear from our last presenter. But I did want to encourage webinar participants to put any questions you may have in the Q&A, and that will give us a chance to try and raise those to our panelists as well. So what we've tried to do in the first two presentations is give you a picture of how both North Carolina and Ohio responded, and how both included a health and education component in their response. So North Carolina talking about reach out and read and engaging through that. Ohio recognizing the social and emotional development as well as the basic health needs of children. And lastly, we're going to hear from Dr. Purishek from the federal Head Start program. And this program, as you know, is designed to have integration between health and well-being and education and parent engagement. So we thought it a nice framework for us to learn about this critically important program, in particular for children with low incomes. And so one of the things we wanted to talk about is how the Head Start programs have focused their early development and learning needs during the pandemic, and specifically some of the new resources that have been made available in the Head Start program and how they're being brought to bear in communities around the country. So I'll turn it over to you.
Hi, thank you so much, Gretchen. It's nice to be here with you all today. So as you pointed out, comprehensive services are the defining feature of Head Start programs. Next slide, please. And the COVID-19 pandemic has implications for how these services are delivered and received. So just to provide some context here, Head Start has been awarded around $2 billion total in COVID-19 response funds through the CARES Act, through the 2021 Coronavirus Response and Relief Supplemental Appropriations Act, as well as the American Rescue Plan. Next slide, please. So as a lead for behavioral health, a large part of my job is to listen and be responsive to what children, families, and staff in Head Start programs need to address their social and emotional needs. And the pandemic has really highlighted that social emotional needs extends beyond mental health services or making sure that children are hitting their developmental milestones. So as you can see from this graphic, there are a lot of ways that programs can think about using their funds. And when I think about addressing social and emotional needs within the context of the pandemic, and I think this has come up from previous presenters already, but making sure that children and families' basic needs are met is first and foremost in my mind. Therefore, meal and nutrition services and family support are highlighted here in this graphic. And there's one program that comes to mind in Cuthbert, Georgia, that I wanted to highlight for you all. We highlighted it through our Head Start Heals campaign animated series, which I'll talk about in a couple of slides, but I just felt like it illustrated this connection so well. This was the only Head Start program in the small town of Cuthbert, Georgia, and they were forced to close during COVID-19. And this meant that many children would miss out on daily meals. And in response, staff developed a plan to bring food to enrolled families in the community. And the story that we highlighted was one child coming back for a second helping of food, but trying to cover it up. And the staff member kind of seeing the crumbs on her face, it's okay, it's fine, you can here's some more food. And the staff member really spoke about just needing to lay eyes on the children that they served to make sure they were okay. And the story also highlighted how important it is for children to have adults in their life they can depend on, both in their family and in their extended family, which really is the Head Start community. So all of these elements, addressing basic needs, connecting with children and families, and supporting them is all integral to addressing social and emotional well-being for children from a Head Start perspective. Next slide, please. So I'm one of the federal project officers for our National Center on Health, Behavioral Health, and Safety, which has a cadre of experts on physical health, mental health, oral health, substance misuse, et cetera. They pulled together this lovely graphic that's also available on our website that really highlights the complexity of addressing children's social and emotional needs and how mental health is integral to addressing COVID-19. And these topics that you have here in these different bubbles highlight ways that programs have had to think about and adjust in the social emotional space during COVID. Programs are having to promote vaccine confidence, both in their staff as well as families, so that parents feel comfortable sending their children back to Head Start programs. We can't provide the services around social and emotional well-being because parents don't feel comfortable sending their children, then we're not going to be able to address the mental health concerns. Staff are concerned about an increase in challenging behaviors. So we have heard about programs sending home social stories through video or paper copy to families to prepare children for the transition back into a program that may feel very different upon reentry. We're also concerned about staff wellness. So we're hearing about programs that are promoting feelings jars for staff and wellness rooms for staff to take breaks in upon reentry into the program. You know, we talk a lot about how you can't pour from an empty cup. So staff need to be able to take care of their own social and emotional well-being so that they can take care of others. Next slide, please. I mentioned Head Start Heals earlier. So this was a campaign that started coincidentally at the beginning of the pandemic. And the focus was really, we were going to do a few webinars to address trauma and trauma-informed care approaches. And it blossomed from just a few webinars to 14 webinars with over 85,000 views. We tried to be responsive very quickly to the concerns that we were hearing from staff and from parents. And all of these webinars are on the ECLKC, which is the Early Childhood Learning and Knowledge Center. You see our website down at the bottom there. We have FAQs related to all of these topics that came up in response to COVID and what families and staff were really struggling with and wanting some answers to. So you can also view the animated series I mentioned earlier, as well as podcasts developed out of the campaign on that website. Next slide, please. I have some monitoring data that our office pulled together related to mental health that I thought would be helpful for our audience today. So in addition to the examples I've already shared about what programs are doing, these are some additional strategies that programs have used to support families and children's mental health and social and emotional well-being. So you can see that 54% of programs reported providing mental health resources to families and children. So just getting the word out, getting the information out around how to take care of yourself during this time was really important for programs to be sending out. The other piece is around mental health consultation. You see that 36% of programs reported providing families with access to virtual mental health consultants. And mental health consultation is something that is built into the Head Start program performance standards, which is our regulation. So every program needs to have access to a mental health consultant. And this is different from therapy. This is about someone with a mental health background coming in and building capacity for the adults in a child's life to help themselves around their own wellness and also to help children with their social and emotional well-being. And you also see here that 37% of programs reported providing workshops or trainings virtually for parents. So really trying their best to support parents as they went to that virtual space, parents who have full-time jobs, so that, you know, even if they can't come into the program and get those needs met on a day-to-day basis, that they feel that they have some supports and resources available to them. Next slide, please. And the last thing I wanted to highlight was just a couple of other examples of what programs have been doing. This first one is around offering virtual telehealth clinical care services that really, you know, help the parents around parenting, but also around their own counseling supports and services. And the second bucket here is around, again, mental health consultants. And I really love that mental health consultants kind of went out of kind of what their normal duties would be and created videos and stories that help children identify and organize feelings and emotions. And they uploaded those videos to the program's YouTube channel so that parents and children would have access to them from home. So I hope that that is helpful. I tried to highlight as many strategies in a quick amount of time for you, Gretchen. I'll turn it back over to you.
Terrific. Thank you so much. We are going to begin our panelist discussion now after those three great presentations. And so again, I encourage folks to add things to the Q&A. But one of the areas that we wanted to turn was to, one, celebrate the amazing work that was done by each of these program areas to be responsive, right? To generate guidance, like you described, Dr. Grove, to move policy. I mean, Medicaid programs moved bodies of policy that would have taken us 5 to 10 years under normal circumstances, but moved it very quickly. And then obviously the Head Start programs were well designed to be responsive, even when unfortunately some of them had to close. So I want to turn our conversation away from what we did to respond to what we're looking ahead to, and wanted to open it up actually to a poll, a participant poll, to ask the participants on our webinar. We're about 128 strong. What are your biggest areas of ongoing concern for young children? And I think we've heard about some of them today in the early presentations, you know, just the missed experiences, right? We may have missed opportunities for development, or we may have missed opportunities to see developmental delays that could have been responded to. The extra stress and strain on families that can move from regular stress and strain to toxic stress and strain. We know that the racial justice movement and the experiences of racism, as well as the disproportionate impact of the pandemic, recession, and racial justice movement have been felt, particularly by children and families of color. And then again, we mentioned these missed developmental milestones. And then there is this concept of sort of just general social anxiety, right? If one hasn't been participating in group activities or playing with other kids on the playground, that can be a little bit difficult to re-enter. So wanted to just, and then I believe there's an other as well, to get everyone's gut check on your biggest areas of concern. So I think we can close the poll, Travis, and see what our webinar participants are worried about. So it looks like the number one is that extra stress and strain. And as Dr. Grove described, those basic needs are really important. And Dr. Parikshik, your story about the little boy in Georgia who was, you know, hoping to get a second helping of food, I think brings to the fore how important those basic needs are. So that's really insightful. I did want to then turn us to the panel to answer that question. You know, as you're looking at your policies and programs, what are you currently most concerned about, and where are you working on? As we said, children are resilient. They're resilient by design, but they need the adults in their lives to be present and to step up and be responsive. And that's all of us, as well as those who are directly involved in children's lives. So Dr. Sando, I think I'll start with you if you don't mind, but what are you all thinking about and looking ahead to in North Carolina?
Sure. Yeah. So I think transitioning out of the pandemic, we don't know exactly what it's going to look like for everyone. And we know already that there are higher rates of stress and depression and opioid use amongst our general population and our youth population. And how we're going to be able to respond to that. We mentioned earlier instituting new telehealth policies and making those permanent are some of the ways that we know that we want to respond to that in the Medicaid program, as well as beefing up our crisis services and really in all of our mental health services, meeting our beneficiaries where they are, and there's no wrong door. All avenues will provide the care that our beneficiaries need. But we are also transitioning our Medicaid program from fee-for-service to managed care at the same time, with a focus on the whole person health. So we've built up our social needs programs and connecting our general population to these programs through a program called NC Care 360, which is a statewide program that connects community-based organizations with the people that need these services. And we had originally planned for that to be statewide by the end of 2020, but moved that up to be done in statewide by the spring of 2020, so 9 months ahead of schedule. And we're going to be connecting that with our Medicaid program. So providing these services to our beneficiaries and getting these non-medical services as part of the Medicaid program. So that's instituting that and getting that in place is definitely a concern, and making sure it's in place and available, and any concerns, questions, or things that arise are resolved by the time that we're out of the pandemic fully and returning to normal life in a full and complete way.
And Dr. Sando, we got a question through the Q&A. It's my understanding, and just for you to confirm orally, that the NC Care 360 and some of those other interventions are from the 1115 waiver that North Carolina. There was a question about using waiver authority to be responsive to these basic needs. And it's my understanding that is the framework you all have been using.
Right. So our Medicaid 1115 waiver did have certain flexibilities that allow us to use Medicaid dollars to pay for some of these services. However, the NC Care 360 program is bigger than Medicaid. It's for our entire North Carolina population, so even non-Medicaid beneficiaries are able to access these this platform, and so we're not using our 1115 authority for the program that's outside of the Medicaid program, but we're coming to all of our programs with the view that we want to provide services to the whole person, because not everything can be accomplished in the four walls of our health system. We need to be addressing those transportation, food, housing issues that contribute to a person's health. So that's really the impetus across the department, not just in the Medicaid program. The Medicaid program certainly is going to be having a new initiative to pay for these services that we're launching during the pandemic. So
terrific. Dr. Pritchik, I'll turn it to you. And we also had a question, and I appreciate the question that oral health is so critical for young children as well. And the Head Start program is known for some of its oral health education. So maybe in your response, a little bit about how you all are thinking about oral health and as kids return, and then also sort of what you're planning for the future with a lot of those new investments and sort of addressing the current concerns you have about children and families served by Head Start.
Sure. So I appreciate the question too. We definitely want to make sure that children and families get the full cadre of services when they're reentering back into the program. And so I don't want to get ahead of my office. I can't say exactly how we're going to be addressing that question around toothbrushing, but I can say that we consider oral health to be very, very important, and we are putting out a lot of technical assistance materials around how to get oral health services for your child in a virtual space. So I'm sorry that I can't be as specific as maybe our audience wants, but there's more to come with that as we are getting ready to put out our guidance around that. And we are working very closely with the CDC to make sure that our guidance aligns with theirs. And as far as other things that we're currently most concerned about and working on to support the early development and learning of children, I talked a little bit about staff wellness. This is something that throughout all of the different funding and everything, we are really pushing to prioritize staff wellness as one of the main areas, making sure that we not only say these are ways that you can use your funds around staff wellness, but really helping programs understand why it might be the most important thing to focus on first and foremost as we go back into programs. There's some new research emerging now around increased rates of depression and anxiety in Head Start staff in particular, and so we really are very concerned about putting staff in a difficult situation, just saying you need to go back and do kind of the normal thing that you did before, but really trying to structure the day and what their schedule will be in a way that is actually conducive to their well-being, with an understanding that they probably have their own challenges that they've been going through. So that's something that is very important to our office and to me, and I'm glad that we have new research to support some of this. The other piece that we're trying to be mindful about and work on is around understanding that, you know, some populations were disproportionately impacted by COVID-19. We're talking a lot about the importance of health equity, making sure that that families and staff who come from underprivileged areas, particularly children of color and their families, have access to vaccines and access to the right health services. And so we're working a lot in that area. And also substance use disorder. This was mentioned by Dr. Sando, that this is a big concern. Opioid use and misuse was something that we were really focused on before the pandemic. And now there is, it definitely didn't go away. And we want to be prepared to address that with staff and also help staff address that with the families and get them the right treatment that they need. Those are the areas that we're really focused on right now in this space.
Terrific. Thank you so much. Dr. Grove, your thoughts on what you're worried about now and what you all are thinking about implementing?
Thank you so much. So we're worried about the things we're always worried about, pandemic or not. So we are a Each Child Our Future strategic plan organization. And what we mean by that is that each child, not every, but each, very intentional language, deserves the opportunity for maximum life success. And in able to do that, we must come around the child from a very early on, prenatal if we can, and support all of the developmental domains. And, you know, in education, it's one piece in part, and we cannot educate children, especially young children, if we can't also make sure that their other developmental domains are, you know, having the same opportunity for growth and learning. So I would just say, pandemic or not, it's always our worry that we are preparing our parents to be the best parents that they can in order to support the maximum development of their very young people so that they come to kindergarten ready and that they have an educational trajectory that is inclusive of belonging and success, both academically and socially. And so we really are concerned about all of those, of course, adding in the stress and the layers of the pandemic on top of all of that normal stuff that our teachers and parents and children face every day. And so, but I am very proud of the fact that we did do something very unique in Ohio. I think unique, certainly different for us. We did not eliminate all of our fall assessments. So remember, I'm from the Department of Education. We did keep our state fall assessments, which in our state include a kindergarten readiness assessment or entry assessment, as well as a third grade reading test for the fall. But what we did uniquely is we actually published that data in late January, early February with a message that said, in the context of who enrolled in these early grades in a year of a pandemic, who is attending, who participated in the tests, here are the results of those state tests, and they should be paid attention to because now all of you, all 1,000 public school districts and community schools in the state of Ohio, by the way, we have bunches, take this information, and this is what you need to do. You need to plan right now for how you are going to support these students. We're not saying learning lag, that was the latest one, learning loss. We're not saying children are behind. What we're saying now is here's some information for you to use to plan for those supports. And luckily we were able to say, plan for them now, plan for them in the summer, plan for them next fall. This is not going to be a 2-week kindergarten entry camp turnaround, all right? You got to be planning for this for the next several years. And actually, we don't yet know the impact. So I'm very proud of that, to be able to say, hey, we have data, we have information that you can then use, and we want you to use it in order to plan for those whole child supports across your school districts and your communities.
Terrific. Thank you so much, Dr. Grove, for that. One of the things that has occurred to me, and we had a question about referrals. In some of the conversations I've had with community and state leaders, you know, the pandemic revealed places where the systems worked really well and reminded us of places where systems don't work so well, like sometimes just handing someone a flyer, hoping they get a referral to some sort of basic needs support, not as effective as perhaps a more structured connection. So when I've been listening, it occurs to me that you all have done an amazing job of seeing the cross collaboration that's needed, because children are both growing and learning at the same time in their little young lives. And so I've heard you all talking about how you've been thinking holistically, but maybe you can speak to any of the three of you on the panel, how you've tried to formalize or ensure better connections between different systems. So, right, the school district had the ability to provide extra food, but maybe not secure housing for a family that's, you know, experiencing instability in their housing. So maybe just any examples you've had of how you formalized or saw opportunities to strengthen the referral process, and whether or not you've learned some successes from that work.
So I think of things to talk about in the past. I want to talk a little bit about the future. In the American Rescue Plan Act does provide some funding to states to build for in our pandemic and to work to address the needs that are out there. And one thing that we've really taken into heart when looking at these funds, and as well as the CARES Act funds and other funding streams, is what can we do that we will have the infrastructure, I know that's not the best word, but the ability to be able to use that plan that we have, or those IT systems for the next pandemic, for the day-to-day operations of our programs, so that we are able to solve the problems of people falling through the cracks, and in areas where we know that we have people in our state that would qualify for Medicaid because they are on SNAP, or they are receiving other services that we know that their eligibility levels meet Medicaid, and we want to be able to connect to them. We're working to try to be able to have the ability to integrate the programs in a way that's smart, in a way that understands the needs of the beneficiaries, and meets the beneficiaries in the settings that are the most appropriate. So that's really the framework that we're approaching a lot of these programs. And I wish I could say that we have this wonderful IT system that now connects everyone. Not quite yet, but it's definitely the goal to be able to make those connections, both from an IT infrastructure standpoint, as well as working with community-based organizations, so that they know where to find the resources and where to be connected. One side effect of everyone turning to the Department of Health and Human Services for the latest news on COVID is we've had a greater ability to reach out to our community-based organizations, to reach out to the general public about the programs that we have here at the Department of Health and Human Services. So we're hoping that can lead to education and outreach to the population that might not have those services on hand.
Terrific. Any other response from the panelists about strengthening those referral systems or connections between systems?
I have an example, but it's pre-pandemic, but I think it actually is a nice example of what we're talking about and what we're thinking about. So, and it relates to us addressing opioid misuse and substance use disorder. So it was right before the pandemic, and we held a series of regional meetings where we brought together state teams and Head Start grantees to talk to one another. And what we found repeatedly was that healthcare providers, so like neonatologists in particular, who were treating babies in the NICU, did not know about Early Head Start and what it had to offer. And they didn't realize that comprehensive services were provided in early childhood and could be a really fantastic place to sign mom and baby up for while still in the hospital. And so once this partnership was realized, we had doctors asking us to put together one-pagers that they could put around their clinic around what Early Head Start and Head Start is and how to sign up. And that kind of partnership was really key. We didn't have that partnership before. And I think what it's allowed us to do is now that in different states where these meetings have happened, after the pandemic, when people were trying to figure out referrals for substance use and substance use disorder, they had somebody to reach out to, right? They had that connection in the healthcare system they wouldn't necessarily have before. And so it was really eye-opening, at least for us, that it was important not just for us to figure out who can we refer families to, like giving that technical assistance, but also educating others around what Head Start can provide, because the partnership is two ways. And so I just wanted to highlight that for you all.
Yeah, and I think we had a question in the chat around Help Me Grow, and right, it is an infrastructure for referral, assessment and referral, as are the 211 systems at many of the United Ways. And one of the questions was focused on areas of new need that have maybe been exposed by the pandemic. And I think just based on some of the work I've participated in, there have been two shifts that I think are worth noting. And the comment was just, I think, builds on that, which is a slightly larger 2-gen lens on a family's needs, right? So the neonatologist was most likely thinking of the baby and sort of knew how to navigate systems on behalf of baby, but not maybe thinking as holistically, not that they were ignoring mom, but thinking about the wraparound services and supports for mom. And then I think this substance use disorder, one of the challenges we face as a nation is a lack of access to appropriate behavioral health supports for all kinds of populations, in particular for families with young children. It's a complex, right? Often the supports are for the adults in the child's life, et cetera. So I think that's some gaps that I've heard about nationally, where Help Me Grow systems or 211 systems were a little stumped, not because they didn't know where to get those resources, but in some places they either didn't exist or they were framed as either support for baby or support for a mom with a substance use disorder, and not really thinking about them in a 2-generation dyadic way. But Dr. Grove, I don't know if you have a response to that question.
I'll just pop in really quick to say we saw some excellent examples of what you're talking about, of these connections. So we did a quick pivot to allow for an EBT card to go to families and children and siblings to get groceries in addition to that nutrition that they would have normally received at school. And so to sort of handle that, the evening meals and the weekend meals, and made this very easy, and it was rolled out very quickly. And so we're proud of that, and it continues. And then another quick example, because our state was very concerned that with children not attending school, we would see a drop in referrals around child abuse and neglect, which is exactly what we saw. And so we were able to get some quick guidance, things out while schools were closed. And one of the great things we did was just have focus groups with our school counselors. These are people whose job it is to lay eyes on children and to connect with children every day. And all of a sudden, their whole world is disrupted. So we found out, what did they need? What did they need to be able to, be okay to show up on doorsteps and to connect with their kids through Zoom and things. So I think those are just two examples of connecting people in a way across the systems that allowed us all to work together to serve our families and children better.
Terrific.
Gretchen, if I
Yes,
can
please.
also, we started a program knowing that a lot of people who have or need to quarantine for whatever reason may not have supports to be able to do so. And so we provided people with food, transportation, and masks, the appropriate PPE, and other safe quarantine equipment that they may need. And through that, you just learn so much about the need that is there that you can't fill with stuff. The counseling needs that were discussed, all the other potential what's going on in the household is there's only so much that you can do through physical items. There's just a lot more additional need that needs to be accomplished through that social and emotional development. And so that was a real lesson learned in how to appropriately provide non-medical services to people in a medical sense, for sure.
Yeah, thanks so much, Dr. Sando. And I actually had the chance to help with building some of those programs here in the state of Colorado where I live. And one of the other areas that came up during that, which is responsive to one of the questions from the audience, is we also found a place of a lot of confusion and a lot of concern were worker supports. So if someone has a positive test, how do they make sure they have paid time off? If it's a negative test, but they have someone in their family who's positive, like there was just a lot of very technical and legal expertise around workplace protections, places that weren't safe, and how you could help someone navigate how they could get time off, especially if it was a caregiving situation. So that's another that I think I would add to the list of things that we learned were really important for family stability, is having the right protections from your workplace and the ability to go back to work when you're able to. So I did want to offer one last opportunity for our webinar participants to drop any questions in the chat or in the Q&A, but also begin to turn us to closing our time together. We only have a few minutes left, but just wondered if any of the three of you see a bright spot in the future, either some new money that's coming from all of these different responses, or a policy opportunity that sort of naturally blends early childhood systems work and Medicaid that you really are excited about or thinking about as you move forward.
I'm happy to go. So I think that one bright spot that the pandemic has really brought to a lot of states is bringing to the forefront the conversation around health equity. And it's a conversation that has been needing to take place for a very long time, and having a focus on that in a variety of different places, I think is going to really make huge improvements in our healthcare system, as long as that continues to drive forward. We here in North Carolina have instituted, we've instituted so many programs, but one is that we are providing payments to our primary care doctor or practices that primarily see people that are in very high poverty parts of our state. So we know that if you live in a neighborhood that is experiencing high rates of poverty, that has so much to do with your ability to be healthy, to do so much going forward. So we are providing payments to providers specifically for them to make investments in health equity. And the way that it is designed is on a per member per month basis. And most of our beneficiaries in Medicaid are children. So a large proportion of the money is actually going to pediatric practices to make investments in health equity, whether that be training or additional resources for mental health and social services, community workers, translation services, et cetera. So hopefully these investments in health equity at a young age will translate into significant improvements in the health disparities that we've unfortunately seen play out so predominantly over the last year. And that's one driving reason I wake up every morning, is in hopes that we're making a difference there.
Perfect. Thank you.
Gretchen, I hope we have just a minute so I can add to what Dr. Sanders said, which I do believe the pandemic brought inequities of all kinds to the public discourse. There are some of us who do this for a living, right? We have these conversations all the time, but I think it brought it to a broader audience. And the benefit and the bright spot of that is what we saw was a reaction and a pivot to actually get hardware, software access into the hands, regardless of your socioeconomic status. And these are things that have traditionally been held only for the wealthy, right? Having a computer at home or a Chromebook at home has not been accessible. And now we see that for the first time, not only that, but we actually laid the broadband wire. So we have made for the first time a whole new global world accessible to children and their families. And this never has to go away. So I think it has done a significant thing for, again, bringing the technologies that are required for education in this time, in this nation, to a larger community. I just wanted to add that to the health inequity conversation as well.
Absolutely, and that infrastructure of broadband supports health as well, right? With those. Dr. Prusek, do you have any final comments before we wrap?
I mean, I really love the enthusiasm of our panel, and really everything that is being said is really what Head Start stands for. And we have been talking a lot about health equity. We're also talking about social determinants of health, and the pandemic has allowed us, unfortunately or fortunately, a place to really give illustration to what we mean around that. And just taking it back to kind of the initial kind of why I'm here as the behavioral health lead, you know, mental health has always come with its own stigma, and it's been very difficult often to really get the services in place for children and families, particularly when you're thinking about mental health as a system that potentially has a history of racism attached to it. And so now we're in a space where we can say, we're talking about well-being. Mental health is a part of everybody's well-being. And everyone has had an opportunity, I think, during this time in isolation to really understand what that means for them, and has opened up the conversation and allowed us to talk about mental health in a new way. And I really feel like that's a bright spot for us.
Terrific. I think it's also reminded us of the resiliency of children, right? And that as adults, they're wired to be resilient as long as we respond when there's disruptions in their lives. So this has been a heartwarming, but also intellectually stimulating panel. Thank you all so much. And Dr. Casso, I will turn it back over to you to close us out.
Thank you, Gretchen. I really appreciate it. So please complete the brief online survey that's going to pop up on your screen. Your feedback is very important to us, and we hope you'll take a moment to do this. As you open up the survey link, we want to say a big thank you to Travis for assistance with the webinar today, to Gretchen for moderating a great panel, to our funder, the Robert Wood Johnson Foundation, for supporting this work, and to the presenters for sharing resources for children and families, and program staff to provide supports during the pandemic and for reentry, ways referrals can help connect families to programs more equitably, opportunities that states have to overhaul their Medicaid programs to better support families, and opportunities to focus on mental health and the unmet needs of families through comprehensive early childhood programs like Head Start. And last but not least, a big thank you to all of you for participating in this webinar, for submitting all of the great questions, and for all that you do every day to help families thrive. Thank you so much. Have a wonderful rest of your day.